In this lesson, I'm going to explain the prolapsed umbilical cord and how you're going to help provide care for this patient. Okay, let's first review what that umbilical cord is doing. So if you remember, that umbilical cord is how the fetus gets oxygen. So now a prolapsed umbilical cord. This means the umbilical cord starts to be delivered before the fetus is. This is so bad. So pressure is applied from the fetus on the displaced cord. Now, why is this a problem? Well, pressure is on the oxygen supply. So it becomes an emergency because if the oxygen supply is blocked off, then the fetus isn't getting oxygen. So our assessment of this. On assessment, you are going to either visualize, you're going to see that umbilical cord hanging through the cervix, or you might palpate or feel a pulsation occurring in your hand on a cervical exam, or something squishy in the vagina. The patient even might feel something squishy in her vagina. So remember, that cord is compressed. So because it's compressed by the head or whatever the presenting part is on it, we're going to have fetal decelerations or variability occurring. So remember, we have our contractions are occurring and that heart rate should be like this. Well, instead it dips down and it probably doesn't return to baseline. We have a cord hanging out, so the oxygen supply is blocked off. And when that happens, we have fetal heart rate is going to be bradycardic because of it. And as you can see in this image, you can see how that umbilical cord is hanging out and would cause a huge problem. All right, so our management of this patient is going to be to never, ever, ever include pushing the presenting part or the cord back in. So don't answer like that if you are asked. Instead, we're going to do a lot of things very, very fast and all at once. Remember, this is an emergency. So we want to elevate the presenting part. So we're not pushing anything back in. We are elevating to relieve pressure. The mother is going to need to either get herself or have help getting herself in knee to chest position or an elevated or a Trendelenburg position on the bed. And that's going to help shift the fetus or open her pelvis with the knee to chest to help relieve that pressure. While you are doing all these things, you are also going to be giving supplemental oxygen. So remember, even if mom's oxygen level is 100%, it doesn't matter. You are going to give her oxygen. And that's because the extra oxygen is going to go to the fetus and help that bradycardia. The patient is going to need to be taken to the OR and prepared for an emergent immediate delivery by C-section. So it's important that you remember the baby can never deliver after the umbilical cord or the placenta. So that's their lifeline. So after hearing all these different things, you are going to think, how am I going to have all these hands to do these things? Well, you're going to call for help. So as you're doing all this, you're kind of multitasking. You're going to yank that call bell out of the wall and get lots of help in there. We had a patient once that the doctor came in to AROM her, to artificially rupture her. The fetal head was not engaged well in the pelvis to block things from coming out. So when she ruptured the patient and that head wasn't down there, the cord came pouring out with the rupture of fluid. So this became a medical emergency. The nurse pulls the call bell out of the wall. The nurse is at the same time elevating, or actually it was the doctor because the doctor was there with the umbilical cord in their hand, is elevating the head off of that umbilical cord. The nurse is getting the patient in Trendelenburg. They're throwing oxygen on. The monitoring is occurring. We're seeing this on a monitor. And then they are rushing back to the OR for an emergent C-section. With this patient, somebody has to stay in between her legs to keep that head off of the cord until delivery happens. So the nurse switched places with the doctor because the doctor had to do the C-section. And she becomes what we call a mole. So she puts on a sterile glove and sleeve and placed her hand in between the legs of the patient, keeping the head off of the umbilical cord while the doctor delivered. So as the doctor goes in through the abdomen for a C-section, and once that baby is pulled up and out, then the nurse could remove herself. So big emergency, but everybody works together. Our education is going to be super quick and to the point. Remember, this is an emergency. So it's one of those times that we might just have to explain everything later, and that's okay. But we need to try to keep the patient calm and give her the information that we can. So we need to get her in position. So knees to chest. Why? It's going to open up that pelvis to help relieve pressure. It might also be the Trendelenburg position, and that's just going to help hopefully move the baby back up out of the pelvis if we can. Oxygen. The extra is going to the fetus, so putting a mask on the patient. And then explanation. So as best if we can, what is happening? We are going to the OR to deliver your baby and make sure your baby is safe. We need to tell the patient to deep breathe, and we are there to do everything with her and help her. In these situations, everyone is all hands on deck and helping, which is great, but it can be very overwhelming to the patient and kind of scary to have so many people in there. So just kind of helping to relieve her as best as we can, and then explain later is what's going to happen. Our nursing concepts for prolapsed umbilical cord are perfusion and safety. So remember, the baby's lifeline is hanging out. So we are concerned about adequate perfusion through the umbilical cord and the safety of mom and baby. All right, let's review what we've learned. So the umbilical cord, it cannot deliver first. So we have to relieve pressure on it. So we are going to lift the presenting part. Remember, we are never going to push it back in. So do not answer that. Never push back. Oxygen, we're just giving extra oxygen and it's going to go to the baby. Position is Trendelenburg or knees to chest. And this is an emergency. We're going to go to the OR and we're going to deliver by C-section. In these deliveries, someone has to stay between the patient's legs and that head, remember, as we're going to the OR. And you can't just say, okay, my job's done once we're in the OR. No, the nurse has to stay there between the legs to help relieve that pressure off the cord. Make sure you check out the resources attached to this lesson, review how you will emergently take care of this patient, and on all the different steps that you will take. Now go out and be your best selves today. And as always, happy nursing.